Good morning. Today, my fellow presenters and I are going to be presenting emergency preparedness. My name is Charles. This is Anne, Caitlin, and Fiona. So a pamphlet is going around, and for those of you that have received it already, if you open it up to the inside, on the first flap, there's a safety checklist of just essentials that you should make sure that your emergency kit should have. And then if you open it up further, you'll see different disaster scenarios, such as a fire, earthquake, other disasters such as electrical outage, elevator problems, gas leaks, and flooding. And then if you turn on the back, the pamphlet has emergency contacts. It has the police department, the fire department, and also the UC medical department. But in any emergencies, be sure to call 911.
Alright, so first we're going to talk a little bit about fire. So I know that the number one rule when in the event of a fire is to stay calm and just don't panic, which is easier said than done, of course. So just a few things to remind you. There is an acronym that I'd like you to remember when it comes to a fire, and it's called RACE, which is Rescue, Alarm, Contain, and Extinguish. So rescue anyone that is in immediate danger of the fire, tell anyone else in the building that there is a fire, and remember to not use the elevator and just use the stairs if you are on a higher than the first floor. Next is the alarm. So you want to pull the closest alarm box near you and then call 911 and let them know what's going on. And then to contain the fire is just to make sure that you close all windows and doors that are surrounding the fire so it will not spread as easily. And then extinguish, you would use a portable fire extinguisher if it's safe to do so in that event. In order to use a fire extinguisher, there is an acronym called PASS, which is pull, aim, squeeze, and sweep. And what you're going to do is you're going to pull the pin off the fire extinguisher. I wish I could show you, but I don't really feel like gassing you guys out. So you're going to pull the pin, you're going to aim the nozzle at the base of the fire, and then you're going to squeeze the handle and sweep at the base of the fire from side to side until the fire has been completely extinguished. Next, I just want to let you know about the different types of fire extinguishers. There are 4 different types. There's A, B, C, and D. Okay, just kidding. A is normal combustible materials, so trash and paper. B is flammable liquids, such as paint. C is electrical, such as wiring. And then K is cooking materials like oil and grease. And in the case of a fire, always call 911, even if the fire has already been extinguished, so they can take the proper precautions. And Charlie's going to talk a little bit about earthquakes.
So in the case of earthquakes, what you want to do in this fabulous skilled nursing facility is that you want to be sure to know the areas that are of hazard, so during an earthquake you're able to stay away from those, and also in just prevention to upkeep them. You want to be sure to have your emergency kit set. But in the case of a earthquake, steps that you want to follow is that you want to avoid glass, windows, overhead objects such as these projectors in this room, the outside doors, and also walls. But during an earthquake, what you want to do, a simple procedure, is that you just drop, you take cover under a table, and then you just hold on until the tremors stop. And then once the tremors stop, able to get up and follow emergency evacuations just as like a fire drill.
So next I'm going to talk about power outages, gas leaks, and then some elevator safety. So in a power outage, the first thing you want to do is locate a flashlight, and your building might have emergency backup lights if you have an emergency backup generator. But in the event that your building does not have that, you want to locate a flashlight. So before an emergency even happens, you want to know where all the flashlights are located, possibly maybe even carry one in a pocket or something like that if that's an option. And then you want to always have the utility company's number on hand. So you either need to have it in your phone or know where it is, have some sort of emergency binder with important phone numbers. And you can call the utility company. They might be able to let you know how long the outage is going to last. if it's only going to last a couple of hours, the food in your fridge should be fine as long as you keep the doors shut. So you don't want to keep repeatedly opening the doors because that's going to cool all the food down, or heat it up actually. But if it's going to last longer than about 3 or 4 hours, you should go get some dry ice to put in your refrigerator to keep the food at an appropriate temperature. You actually can go, if you know where your circuit breaker is and if it's safe to do so, you should go and check it to make sure that the power outage wasn't caused internally. If it's something you can fix yourself, then you don't even need to have the utility company come out. If you can reset the circuit breaker. And then you also want to keep any patrons in the building really nice and calm, keep them informed so everyone knows what's going on. We don't want anyone panicking, running around, getting injured, anything like that. And then you never want to taste or smell, you never want to rely on taste or smell to check any food that has been in the fridge after a power outage. Some food can go bad and you wouldn't even know by looking at it, tasting it, or smelling it. So you never want to taste food or smell it to make sure that it's still okay. And then as far as gas leaks go, any tiny movement in a pipe or a tiny crack can cause a gas leak, and a lot of them you can't even smell, so they're very dangerous. So if you suspect a gas leak or you do in fact smell any gas, you want to immediately evacuate the building, have everyone inside, wait outside at a safe distance, and then you want to immediately call the gas company. And you can actually shut off the valve yourself. It should be over by the meter on the outside of the building. So you want to completely shut it, note the numbers that are on all the dials, wait about 5 minutes, go back to the valve, and if the numbers have changed, then it's not actually shut, and you definitely want to let the utility company know about that. And then as far as elevators go, you never want to use an elevator in emergency, so always use the stairs. You never want to use an elevator after an earthquake, fire, flooding, anything like that. So when you're in the elevator, if you do in fact find yourself trapped, there is usually, or there should be, a call button in the elevator. So push the call button. If there's no response from that and you do have your phone with you, then you can go ahead and call 911. If you're still not getting a response from the call button, there should also be an alarm button which will notify the fire department. And usually if you're trapped in an elevator, someone outside, if there's not an emergency, if it's just an electrical thing, someone outside is going to eventually notice that the doors aren't working and the elevator stopped. So someone will come and get you, so just stay calm. They're not just going to leave you in there. And next, Anna's going to talk about the lovely emergency kit that you should have.
So yeah, I'm going to highlight some of the things you should have according to the Federal Emergency Management Agency. And they recommend that you have at least 1 gallon of water per person per day for drinking and sanitation. And juices are always great for people on liquid diets. And you need tools like straws for people like that with special needs. And packaged foods and ready-to-prepare meals like oatmeal are also a must. And you should have Nephro for people who are on a renal diet so that they can get a high-protein, low potassium intake. And canned foods like high-energy foods like chili and beans, and always have an alternative source for like people that need lower sodium. And canned tuna and canned chicken are also a must because you can make quick foods like tuna and chicken sandwiches. And bleach is always necessary too because 9 parts of water and 1 part bleach can be used to act as a disinfectant, and you can also add 16 drops of water into a gallon, 16 drops of bleach into a gallon of water to purify it. And you should have Band-Aids or, of course, a first aid kit on hand, and any disinfectant wipes, hand sanitizers, and several ointments for cuts and burns, and like anti-inflammatory creams. Alternate light sources like candles and matches or lighters and batteries. And you should always have can openers and a wrench so that you can turn off utilities, scissors, and of course a thermometer so that you can keep food out of the danger zone. Now I'm going to move on to the real life example. When we visited URC, we had the opportunity to look at the equipment supply room and take inventory. And with the registered dietitian, Connie Belk's permission, we were able to take some pictures and look at their emergency packet. And so we made this packet to kind of emulate what was in that packet. None of the information was directly like stolen or anything like that. So I'm just going to briefly go over what is in this packet. You should have emergency water needs for people and how to disinfect the water, and also evacuation drills, including alternate sources of transportation like the Unitrans or YOLO bus, and contact lists, and also other sources of food like nearby markets, Safeway, Save Mart, and other facilities that are nearby with kitchens, like it would be Sutter Davis, and an emergency food supply list, including some of these things that are seen here. You should also have what to do in different scenarios, like if you have no gas, you can't use the dish machine, there's no power, and no water. And there's also prevention action plans for employees in here, like you should never light an open flame in a dining area or kitchen. You should never store aerosol cans next to a heated source. And you should always report a fire, of course. And when you get a chance to look at this, it's coming around, you can see that this is how the URC supply room is organized. And boxes cannot be stacked higher than this tape around the room shown here. And boxes should always be labeled with the expiration date. And included in this packet is also a list of patients with emergency needs, or they have like impaired hearing or vision, and non-emergency food supply list, as well as emergency recipes to make things quickly, like enriched hot cereal or a bean salad, or like I mentioned, a chicken or tuna sandwich. And there's also a simplified emergency menu tailored to individual needs, like people that are on a regular diet or a renal diet or a mechanical soft diet or a no concentrated sweets diet. And there's also a list of what to do when you are planning a disaster menu. And lastly, you should have an evacuation map and a map leading to the emergency supply room.
So in conclusion, with our presentation, we wanted you guys to feel like you were employees of a skilled nursing facility. So with all that, we know that fire, earthquakes, pretty much any disaster is a little bit more stressful with those who have problems with mobility or problems hearing, or especially with food, with problems eating or certain allergies. So we hope that you guys take this for sure to heart and really understand what's going on, because I know that a lot of it is common sense, but in the state of an emergency, you will panic. So just try and remember little things to make sure that you can get everyone out safely, as well as yourself. Does anyone have any? Oh, sorry. Does anyone have any questions? Okay, we figured that would happen. So we have. We do not have. Oh, we have some scenario questions for you guys, so please don't leave us hanging. So just imagine that you are inside the facility and you hear the fire alarm go off. The door to your office is shut and you can see smoke coming in under the door. What should you do?
Participation.
One person will survive. Yeah. I'm sorry?
Do you have a window?
No.
You would have no window.
No. You're in a closet. Your office is really a closet. You're not that high up on the ring. Yeah.
Don't you just put like a towel on the cracks so that the smoke doesn't get in? Wait till it's safe.
Yes. So one thing is to test to see if the door is even hot. So you can just kind of like tap it. Because I mean, if it's not hot, you can still open it and see if you have a way to escape, or if you're just kind of stuck in the corner of the building and the fire is way down the hall. Also, like what Catherine said, look for a window or an alternate exit. If there happens to be another window or another door, please try and take that. And then when you're going to block something with the bottom of the door, try to find something that's wet, or if you have a water bottle, pour it over a jacket or a towel or something, because that will help the smoke from coming in just a little bit better.
So in the event of an evacuation, the next scenario, so after an emergency, you're outside at the designated meeting place, and you notice that one of your coworkers hasn't made it to the meeting place yet, and you're worried that they're still trapped inside. What should you do? Or maybe what should you not do? Yeah?
So you should tell the emergency personnel that arrive on the scene.
Okay, what if they're not there yet? Anyone? Yeah?
You should not run back into the building to look for them.
Exactly. So you never want to go back into a building to look for someone, as hard as that may be. Wait until the emergency personnel get there and let them handle that, because they are professionals.
Okay, so in case of an earthquake and in case of an earthquake happens, but none of the exits are blocked, what do you do?
So you're not trapped, in other words. There's an earthquake, you notice that you're not trapped, what should you do?
Like the earthquake with seal the door or something like that.
Yeah.
And you would go under a table and put it on until the earthquake stopped.
Mm-hmm. And then,
You wait for the tremors to stop, and then you follow evacuation plans.
Would you keep the door open just in case if there was an earthquake?
I think if the door was open, then I would just leave it open, but I wouldn't get out of your way to go open the door. I would just take cover immediately.
Yeah.
Because you never know when something's just going to come and fall down from the sky.
I heard one of the safer places to go is to stand in like the middle of like a doorway.
So that is true for
older buildings.
Yeah.
I think in newer buildings, it's actually not a very safe place. Probably your best bet is along any interior wall that doesn't really have anything hanging above it, if that's your only option and you don't have a table. Yeah, in older buildings, they do say the doorway is safe, but in newerly,
In modern buildings,
not really.
not as structured.
Not as structured.
Or if there are no tables, what you do is you go to a corner.
So like right there would probably be perfect.
Okay, so what are some things you should do immediately when there is a blackout or power outage?
Try and find another source of light.
Yes, like flashlight, candle. Anyone else?
Just a little note to that, you never want to have an open flame after any sort of emergency, because even a power outage or a blackout, you don't know what caused it. So you never want to have any open flames, so like lighters, maybe a candle if it's really contained could be okay, but you don't know if there's any gas that has escaped. So an open flame is probably not a good idea. A flashlight, or even the flashlight on your phone, because everyone's is permanently attached to them these days, would be perfectly fine.
Okay. Yeah, and then you want to also stay away from outlets and wires because you never know when they will ignite or spark. And then you want to move outside and wait in the designated area.
That is our presentation.
That's it, unless anyone has.
Have any of you been